Hello friends, to introduce myself, I am Ajay Garg, working as a Director of Hospital Administration in a private medical college in India. By profession, I am a chartered accountant, but I am into the health sector from last almost 30 years now. During my tenure of this being in health sector, I have worked with many hospitals, operated many hospitals, designed and planned few hospitals. I don't know how and when this hospital sector, including medical colleges, it became my passion over a period of time. I was deeper and deeper involved in the designing and planning, setting up and operating the hospitals and medical colleges. Recently, I have launched this book. This is called the Manual of Hospital Designing and Planning. Basically, this book contains details, minutest details about the setting up and designing of the hospital. During my tenure of being in the health sector, I had a chance to visit many countries, cities, towns, villages, and had a look on the hospitals, including the dispensaries. I found that the design may differ from country to country or from city to city, but the basic requirements and necessities were the same. I think you will all agree with me that hospital building is a more complex building to design, plan, and operate as compared to any other commercial building. Therefore, the hospital setup requires a particular trained training and designing for setting up the project. So when I visited these hospitals, I found that there are lot of flaws in designing the buildings. You see what happens, the promoter, if he is a doctor, he feels comfortable with his own experience in designing the things, and he hires an architect who may also be not experienced in the designing of the hospitals. So a lot of flaws are left, like the designer will not consider the area requirements properly. He will not provide for the required rooms, their sizes, and the rooms will be too small or too big, but not as per the actual requirement. More problem was with the waiting areas. I could hardly find any hospital where the adequate waiting area was provided. So considering all these things, I was very upset that how the things can be set right. I was totally confused what to do. Suddenly I got an idea, why not to share my practical experience with the promoters, designers, and give them my feedback. So I started writing this book. If you see this book in detail, book is divided into about 49 chapters, wherein we have given the in-depth material about designing and planning. What shall be the initial planning? What shall be the sizes of the rooms? What all rooms are required for the hospital? How the electrical fittings have to be done? How the support services have to be provided? Then what about the ancillary services? Usually people, they don't care about the ancillary services like your kitchen, your laundry, your CSSD. These are equally important departments. So after completing this manuscript, we were lucky enough that Mrs. Springer Nature, they agreed to publish our book. It took about 1 year to release the book. Presently, as per my knowledge, the book has been printed from different countries like USA, Netherlands, then Singapore and India. Further, I would like to highlight that the beauty of this book is that it is written in a very simple English. An ordinary person can easily understand the English. And the details in this book are purely based on the practical working experience, which is more relevant in case of the setting up and designing a hospital. This book is of much beneficial to the architects, promoters, designers, and even the students of hospital administration and architecture. This book is available in both the formats, that is hard copy as well as the e-books. Book is now available on the Amazon, Google, Springer Link and few other websites. So I think you should just have a look on this book. It will be of much benefit to you all. Thank you everybody.